Doctors at Walter Reed say Defense Secretary Lloyd Austin was hospitalized due to complications from a surgery to treat prostate cancer. President Biden and other top administration officials were not informed of Austin's hospitalization and diagnosis for several days. CBS News national security correspondent David Martin reports from the Pentagon.
Secretary Austin had surgery for prostate cancer more than 2 weeks ago, but hid the diagnosis from his commander-in-chief until today.
The president didn't know about the diagnosis until this morning.
Austin underwent surgery on December 22nd. CBS News chief medical correspondent Dr. Jon LaPook describes the operation, which the Pentagon called an elective medical procedure.
When you take out the entire prostate, it is a major operation.
On New Year's Day, Austin began to suffer complications,
including nausea with severe abdominal, hip, and leg pain. Initial evaluation revealed a urinary tract infection.
This is an unusual complication. Usually these surgeries, they are big operations, but people recover very well, generally without any kind of a complication like this.
Admitted to the ICU with a tube down his nose to drain his stomach, Austin turned over his powers as Secretary of Defense to his deputy, but waited 3 full days before telling the White House he was in the hospital.
It is not optimal for a situation like this to go as long as it did without the commander-in-chief knowing about it. That's not the way this is supposed to happen.
The White House ordered all cabinet secretaries to immediately report whenever they are not able to perform their duties, and the Pentagon began a review of what took so long. Austin's spokesman provided one answer.
Despite the frequency of prostate cancer, discussions about screening, treatment, and support are often deeply personal and private ones.
Yes, it's a very sensitive part of the body, but it's important for men to know what their risk factors are for prostate cancer to get screened appropriately.
Because they caught Austin's cancer early, his doctors say prospects for a full recovery are excellent. But he will also have to recover from an examination of whether his desire for privacy led him to violate laws governing the transfer of power. Jeff?
David Martin, thank you. CBS News chief medical correspondent Dr. Jon LaPook joins us now. John, how serious is this situation?
Well, having prostate cancer and then having that lead to a total prostatectomy, meaning you take out the entire prostate, it's a major operation. I mean, it was elective in that he didn't have to go in right away. It wasn't like an appendectomy where you needed to go in that same day. But he was diagnosed in early December. They decided to take out the entire prostate. The release says, the news report says that it was found early and that the prognosis is good. But it's a big operation to take your prostate out. Now, normally, you know...
But a common one.
A common one. And normally, if you take out the whole... I just spoke to Dr. Herb Lepore. He's the head of urology for NYU Langone Health, where I'm a professor of medicine, in full disclosure. He's a world's expert in prostate cancer. He said that normally you do the prostatectomy, you can do it a number of different ways, and then the person goes home the next day, they have a urinary catheter in for about a week, and then usually he tells them most of the time they can go back to work in about 2 weeks, maybe a little bit longer.
But complications like this are very rare.
They're rare, exactly. And, you know, they talked about that there was some urinary tract infection and then that some fluid built up in his abdomen, and that led to a malfunction of his small intestine. So I guess the fluid backed up. It's called an ileus, I-L-E-U-S, and they put a tube down his nose and drained fluid from his stomach and relieved that pressure.
He didn't say anything to the administration before he went in, didn't say anything initially after he went to the ICU. You think this is a missed opportunity?
I do. You know, first of all, I think, you know, I'm saying it was...
Not talking about his condition and everything else, we understand that, but in terms of awareness.
Yes, 2 parts of it. One is, you know, just being forthright and saying exactly what's happening. Even the statement today, I have to sort of guess that it's something called an ileus. I don't know for sure, but I shouldn't be in that position. They should just tell us what happened. The second is the opportunity to raise awareness. I mean, he is somebody who's well known. You have a common cancer. It is especially a problem in black males. I mean, it's about 1 in 8 in white males and 1 in 6 in black males. They tend to be diagnosed later and have a worse prognosis. So it's an opportunity to raise awareness about it in terms of discussing about screening.
They did say he was never under general anesthesia. He was always conscious after he went into the hospital, second, which is good news.
Right. So he had the first operation. He did have general anesthesia. Then he went home, had the complication, came back, and he didn't need to be under general anesthesia since then. I think they mentioned that because they were saying, was he aware enough to be able to, you know, give advice and things like that.
Okay, Dr. Jon LaPook.
Jeff,
Thank you.
always a pleasure.
Always.